So, how did Riley Hospital get started? First of all, there was a big need for a children's hospital. There was no children's hospital in Indiana. When James Whitcomb Riley, very famous poet, died in 1916, his famous friends got together.
And they said, we need to build a children's hospital. One of the great things about those founders is that they said all children, regardless of their skin color or their religion or their ability to pay, will be cared for here.
And it was the only hospital in the city in which Black patients or patients of any color or religion were admitted and not segregated. And that's just the way it was from the very beginning.
If you look back in the 1920s, 1930s, or even into the 1950s, poliomyelitis was the reason why a lot of different children hospitals were built in the United States.
My name is Annalee McGee, and I'm a polio survivor, and I am 89 years old. I was admitted to Raleigh Hospital in 1944. Of course, right away I was started with treatments. They also had the Sister Kennedy hot pack treatments. So we would have 6 and 7 of those, and they were really hot. Those were on almost an hour before they would take them off. And then in between times, we would have school, and we would have needlework. They also had the exercises, and it was hard. Those exercises were not easy.
In 1938, there were essentially no antibiotics, and there were very few vaccines. And so a lot of infectious disease was saying, you have this. Can't do much about it. I'm on the American Academy of Pediatrics Committee on Infectious Diseases, and we write a book on infectious diseases. It's sort of the Bible of infectious diseases in children. How do you identify them? How do you treat them? How do you prevent them? And this was the original book written in 1938, and this is the book that was written in up to 2024. There's a new edition coming out. And the reason for the difference in size, you can see a very big difference, is because we have therapies we didn't have before. And so a disease like smallpox, which was present when I showed you that first book, it's gone now. It's eradicated, and it's killed probably tens, if not hundreds of millions of people over history. And now it's gone because of vaccines. And many of the other diseases that were in that book, we see very rarely because of vaccines. The combination of vaccines to prevent diseases and then antibiotics to treat them if you get them has been this incredible revolution in medicine. And what it means is that children survive. I mean, children died from those diseases, so now they actually can make it to adulthood, and it's just an incredible transformation.
And then people start realizing that, we don't need hospitals just to care for poliomyelitis. However, we have all these other conditions that children need to be cared for and evaluated and treated. And that's basically what you've seen in hospitals, including Riley Hospital for Children, has sort of evolved into that.
So time went on, and we learned a lot more about medicine and children, and penicillin was just like a whole bunch of things happened. And so we needed more space. And so they expanded this building. And then in the 70s, we added what we would fondly refer to as phase 2, which was our first big NICU that was wide open and had tons of baby beds just lined up in rows. And we lived in that building for a very long time.
When I first came in 1978 and saw a new focus on incorporating families into the care of their child, it made a lot of sense to me.
If you go back to the 1930s, visiting hours at most hospitals were 2 hours or 4 hours on Sunday, maybe. You know, many of us can't imagine how it would have been back then, but of course times were different then.
I was in the hospital approximately 8 months without being able to get out and go out and do anything. We were only allowed 2 visitors per week. That was on Sunday. I had 3 brothers at that time, so my father waited in the car for my mother to come in and see me. And so that was kind of hard too. You just had to accept it. I mean, that was the only thing that they were going to be able to do.
The patient isn't a heart problem or a kidney problem. The patient exists as part of the family. And without focusing on the family, we can't really do the right job for the kid.
And that was fundamentally changed by Dr. Green and by a nurse that he worked with, Margaret Martin.
They had this idea of developing a unit called the Parent Care Unit, where families could live in with their child in a hotel-like room, and the parents could learn how to take care of their kid. And it was a spectacular unit, first in the country, and copied elsewhere all around the country.
So I think with that vision that he had, that's what brought in specialists, that's what brought in, other training programs. That's what allowed, lowly residents like me to be a part of this. And it was just great to be here.
So prior to the early 70s, there was no such thing as a full-time pediatric anesthesiologist. And this is typical of most specialties. Heart surgeons weren't just pediatric heart surgeons, they did adults and kids. And the whole field of pediatric subspecialty evolved after that.
When I started here in the late 1970s, there wasn't enough pediatric cardiac surgeon for Dr. Harold King, my predecessor, and I to be, engaged full time. So for the first 10 or 15 years of my practice, I did about half adults and half children. In adult cardiovascular surgery, there are about 15 major procedures. On the pediatric side, and those things we do at Riley, there are about 250 different cardiac surgical procedures that we need to know how to do and do well. We've been at pediatric heart surgery here since really the late 1940s. We were one of the first programs in the countries to take on pediatric cardiac surgery. It started with Dr. Shoemaker, who came here in 1948, continued on with Dr. Harold King, and then I was the third chairman and chief of cardiac surgery, and then Mark Turrentine, one of my trainees, is now the current chief of cardiac surgery. So there's only been 4 of us in about 80 years. I started the cardiac surgical transplant program here at IU in 1986. We did our first newborn heart transplant here in about 1990, and I think we've done well over 250 children here at Riley since that time.
John is also noted for coming up with a number of very innovative firsts in open heart surgery. The youngest kid to have a heart transplant, John did that, and with help from Mark Turrentine, did the only newborn twin-to-twin heart transplant in the world.
And it's the cooperative thing that goes between cardiologists, the nursing staff, in and out of the operating room, and then the cardiac surgical group. And we're always helping each other whenever we can. We're not trying to keep our secrets to ourselves. We're trying to actually tell other institutions what's worked well for us, and so that maybe they'll want to adopt some of the techniques that we've developed to help us get the outcomes that we've been able to obtain. And I have to say our outcomes seem to be always in the top 10% of the country.
To be a great children's hospital, or any great hospital, you got to be doing a critical mass of research to make things better. That's how everything gets better. So early on, Riley Hospital did research, just like a lot of other places, but not a whole lot of it. The first facility that we had was the 1949 research building. A few years later, they added on to that. After the 1986 inpatient addition was finished, my predecessor, Maury Green, who was chairman of the department, started planning for a new research facility. And we wanted to name it after the chancellor of Indiana University, Herman B. Wells. We were very fortunate to be able to attract David Williams, and within 10 years, he built the Wells Center up from a very small research program with a couple very good researchers in it, but to a top-notch program. And that's how the Wells Center developed. We were able to build a bridge walkway from the 5th floor of Riley to the 4th floor of the Wells Center across the street. It was a wonderful physical and metaphorical bridge between the hospital and research.
That is one of the beauties of coming to a hospital like this. It has a strong affiliation with the Indiana University, with the School of Medicine, and other universities within the state. So that brings more innovation in and more collaborations. And who's the people who benefit from that are the children. The children are treated as if they were part of us, right? I think that you see that at all levels. You see it at the levels of the physicians. You see it especially at the level of all the nurses, respiratory therapists. I think we're very fortunate to have a cohort of individuals that have been recruited here that offer the best care you could receive anywhere in the United States and in the world.
Riley Children's has been a fantastic organization for 100 years, and I was grateful to have the opportunity to be a part of that history. But while I was here, it was when Ryan White was a patient, and that was an interesting period of time for the institution.
Our first real pediatric infectious disease doctor was Marty Kleiman. Marty came here in '76, and he was an incredible clinician and teacher. He didn't leave any stone unturned when trying to come up with a diagnosis. Ryan was a young boy and had AIDS, HIV, from transfusions he received because of his hemophilia.
When he went to school, the parents and the students didn't want to be around him because there was so much fear around AIDS. At that time, it was mainly homosexuals and drug addicts that acquired HIV/AIDS. And he was the first person to put a face on this and change people's attitudes towards HIV/AIDS and its treatment.
He sued for the right to be in school, which went all the way to the Supreme Court, and he was allowed to be in school. And in the process, he became a hero.
Not to mention, it started the Ryan White Care Act in his honor in DC, which has helped thousands upon thousands of people get access to medication and to care. And that all really started from the words of one little boy and his lion-hearted doctor who just continued to do their work in advocating. I don't think you can be in medicine and not be an advocate, especially when you work with populations that their voice isn't always heard. You have to use your voice on behalf of those who cannot. For Riley, we are committed that this is an important part, and we are going to push the envelope of research as much as we push clinical care. Dr. Miyamoto is one of our greatest, most famous pioneers who came from Riley. So, when children can't hear, they stop smiling, they stop talking. So Dr. Miyamoto, he racked his brain about how are we going to help these children? How are we going to make up for that deficit?
He had this crazy idea in the '70s that cochlear implants might work for kids.
I tell Rich Schreiner it started with a bad idea and no money. When your ear's working normally, sound comes in, it's a vibration, but then the little hair cells in your inner ear convert those vibrations into electrical signals. And that's the thing the ear can't do in a deaf person. Cochlear implants creates the electrical signal and puts it in. This is where the basic researchers told us that you'll never get there with a little implant. And we have 30,000 nerve fibers here, and we've got one little squiggly electrode here. Well, it just doesn't add up.
And Richard, as he said, fortunately wasn't smart enough to listen to all the naysayers that said it would never work for kids.
We got the interest of NIH, but we had to let some of our patients grow up and demonstrate what they can do. And my very first patient, he got an implant when he was 16 months old. And we just kept watching him and see if he would start separating himself from other deaf kids.
I'm Grant Phillips, and I was the youngest cochlear implant recipient. I was born in September of 1993, and my parents first noticed that I wasn't responding to hearing loud noises and things like that. Dr. Miyamoto was able to basically pioneer the cochlear program with me. I don't know where I would be without it. I've got a degree in public safety management and criminal justice. I met my wife in high school. I've got two beautiful little girls. Understanding that I would not have been able to hear their voices and things really puts it into perspective, what I've been blessed with.
This changed everything, and it's hard to argue that this project didn't work. There was a time when we probably had 20% of all of the implant patients in the whole world right here at Riley Hospital. And now deaf kids are getting cochlear implants all around the world.
One of the things that has really helped with leadership stability here is our strong relationship with the Indiana University School of Medicine. For a really long time, the School of Medicine was Riley Hospital and vice versa. We began to expand and we joined IU Health. Then we opened the Riley Outpatient Center because we got better and better at taking care of kids and realized only about 15% of kids are going to need the hospital, but 100% of kids are going to need clinics. In 2011, we opened the Simon Family Tower, which is a 9-story building that has everything state-of-the-art for the care of children.
Historically, where we had always thought about things as either age-based or we would kind of group patients together, with the Simon Family Tower, could we put cardiac care, cardiac intensive care together in geographic space to think about the multidisciplinary team together in a completely different way? And I think it was a great example of where we're now seeing most children's hospitals go as when they think about programming in new buildings. It really is about that expertise of specialty being together in one center to be able to do that work where kids are getting the best outcomes. For me, certainly opening the Simon Family Tower was the highlight of a lifetime. To be able to open the building and know what a difference that was going to make for countless number of kids and families in the state of Indiana. You just recognize that you have your time where great leaders before you have built a tradition and a culture and a commitment to children's health. So your role is always to think about like what's next, what can we do, and then continue to move that forward, thinking beyond just Indianapolis and like how do we think about these barriers for families, the cost of travel, disruption from work, being away from their families and social support by coming to Riley and Indianapolis. How could we think about a model that really moved that care closer to home, closer to all of our communities, so that patients and families could receive Riley level care, but could do it without some of those disruptions. And so Riley at IU Health North was kind of that first example for us to really show how we could deliver Riley level care outside of the main hospital and everything that came with that.
When I became the CEO of Riley Hospital, I realized that an important opportunity for us was to ensure that every child who wanted to get or needed to get Riley services could access them. We began to see patients in South Bend, in Fort Wayne, in Evansville, and that took Riley's name out throughout the state. And today that strategy is really one that is so impactful. And that's why Riley is known throughout the state of Indiana. And it goes back 100 years. And that's what we're celebrating today. And I'm just so honored to be invited to be a part of that celebration.
The hospital's grown probably 2.5 times since I was last here. It's absolutely impressive. It's a gorgeous facility. And you can tell the pride in the staff when they're talking about this and when they were giving me a tour. There's a great deal of pride and well-deserved.
One story that sticks with me is that the head of nursing, Margaret Martin, said, "We may not be able to heal every child that comes to Riley, but we can offer comfort to every family." And I that was so impressive to me. And I think that's what we want our philosophy to be.
I'm Dennis Murphy, President and CEO of IU Health. Our goal is to make Indiana one of the healthiest states in the country. And so when you think about that and the implications for Riley, that is, how do we make sure every kid is the healthiest kid in the United States? If you're going to improve the health of children in the state, it's not just when they're sick. You actually have to get upstream and think about all of those determinants or impediments to health that children face, whether that's education, food access, are they having safe places to live? You've got to actually get outside the 4 walls of our hospital and our facilities and really engage in communities to help make them healthier.
So we started a new thing. It's called the Office of Community and Child Health. And it really is to focus on how do we partner with organizations to help solve these problems in a more meaningful and larger way.
And that's a big obligation, but gratefully, I think the team at Riley is one of our most innovative in the health system. And you see firsthand how all of the values we have at IU Health are embodied there. The idea of serving with purpose, the level of excellence for every single person who works there, from the moment you walk in and meet the security people, to the people in the cafeteria, to your nurses, to your doctors. They work as a team, and just the compassion.
If you look, you'll see that the values didn't change. The values still are the child and the family and taking care of those. So if it didn't change in that 50 years, I wouldn't see it changing in 50 more years, because the values of that foundation, and the foundation's going to be there to continue to support the families as a whole unit. And I think that when that value is there, you just can't beat it.
What makes Riley Children's Health so special are the people, the physicians, nurse, researchers, techs, therapists, pharmacists. They're absolutely amazingly talented, humble individuals dedicated to taking care of children. They'll do anything. And there is no place you'd rather be than here if your child is ill. My wish for the next 100 years is to build on the great legacy of Riley Children's Health. We've been a wonderful hospital. Over 100 years, advances in medical technology, innovation, research have occurred here. Now it's the time to push it as far as possible. Reach as many people as we can, every Hoosier child and beyond our borders. That's the next stage for Riley Children's Health.
My wish for Riley Children's Health is that we can expand our services. I'm looking forward to the continued expansion of telemedicine that can allow us to actually provide some of this care in their homes.
I think the future for Riley is that we will always stay a kid-centric, family-focused hospital, but more and more that we're going to be really involved in making sure that those that have the least, whether locally or globally, are taken care of. And I think that's a priority for every single person who works here. People really get that.
For many years, people had this impression that Riley was the place where children came to die. That's not the case anymore. They come here to survive and to thrive, okay? And I think that's what we see on a day-to-day basis around here. There is no question that when you talk about children's health in Indiana, people say Riley Children's Health. Okay, they state it as such. It may have to do with the wagon, right? But it's beyond that, right?
So I think when you're in a place that is built around and inhabited by children, there's just sort of this inherent joy that's always around you. And when you walk through the halls and you might get your ankle hit by a remote control car and you see little kids in the playroom, it kind of lifts your heart. But I also think when you are fortunate enough to work in a place where you can go home every night and you know that what you did today really mattered in the life of a family, and you can say that to yourself in the mirror and know it's true, that just builds that inner spirit.
Why is this hospital so beloved after 100 years is because people that come in sense absolutely our very, very deep commitment to children. And it's a message that comes from the top down and from the bottom up. And people get that it's meaningful. And in the end, all of our lives are about meaning. And this is a very meaningful place to work. So yeah, I'm very proud of working here.
We have to provide the very best state-of-the-art medical care for sure. That's a given. But along with that, I think we learn the art of medicine by listening to families and parents and children themselves, and maybe learn to do a better job with the next family and the next, and then hopefully share that and teach that and mentor that to others, and then it ripples. To me, that's what makes Riley Riley.
Happy 100th anniversary, Riley.
Happy 100th anniversary, Riley.
Happy 100th.
Happy 100th.
Happy 100th anniversary, Riley.
Happy 100th anniversary, Riley.
Happy 100th.
Happy 100th.
Happy 100th.
Happy 100th anniversary, Riley.
From the 100th heart transplant recipient, happy 100th, Riley.